everyone. I'm Jayne and other than the video Happiness Is, I used two sources from online, one by L.B. Andrews, and the article is called Depression and Suicide, and it was written in March 2012, and another one is by B. Hendricks, and it's called How Many of Us Are Really Depressed, from September 2010. Okay, so just an alarming statistic. Everyone in this room is in the most vulnerable age group for depression, which is the leading cause of suicide. 14.8 million Americans are clinically depressed, which is different than when you just say, oh, I'm depressed. Like, there is a medical standard of depression. So young people ages 15 to 24 years old, suicide is the third leading cause of death, homicide being 15th. So that just kind of shows how big of an issue suicide is. Today I'm going to talk about the top 3 causes of depression, which are alcohol and drug abuse, stress, and severe medical conditions. Okay, so first I'm going to expand on alcohol and drug abuse and its impact on being depressed. So many of you may have heard of problem drinking or drinking away your sorrows, or maybe you've even witnessed it. A lot of us see it in our family members or people that we live with, like if they lose their job or your parents are going through a divorce, or maybe even like there's a death in the family. And this leads to some of them just drink more often, and that does cause larger issues. They think that they are escaping reality by doing this, and when they are sober, they're looking back and they're saying they feel sorrow, they feel, they lose their self-confidence, and they just really, they aren't, they lose their self-esteem pretty much, which can obviously cause depression. Some people think that they are self-medicating themselves, which is not advised by anybody. They think that they're just removing all of their problems and numbing their pain, which in the moment they are, but over time they're not. Drug abuse may start as a recreational thing, like, oh, I'm going to go out and party this weekend. A lot of us are either 21 or over 21, but it starts off recreational, but the drugs can become an addiction which is a serious problem. The person becomes completely dependent on the drug to feel normal, and this ultimately leads to depression. So when you feel like you're dependent on someone else, you often get really stressed out, and which brings me to another point. Stress is another top cause of depression. So stress is obviously a normal fact of life. You know, we're competing with other people all the time. We always want to make it to that next spot. You know, stress comes with pretty much all the good things that are in life, and people obviously handle it differently. Some people either crack under the stress, or they use it and they stay motivated and they just keep moving up. But there is something called clinical stress. You become clinically stressed, which is just the stress doesn't let up. It just keeps pounding on you, and then that is when it really actually gets dangerous, other than if you just are stressed because you have a test next week and then it goes away. So, a study was conducted examining 75 moms between the ages of 15 and 19 years old, so pretty much just teen moms, and they determined the relationship between stress and behavior. So they studied that the moms that were single were obviously more stressed. They didn't have any support from anyone, and it did show that over the time they became clinically depressed. And also they saw that in the other moms that were had the dad still there, they weren't as stressed and they were not depressed. So the way stress can lead to depression, just like a medical thing, is you have an overproduction of a hormone called cortisol, which is the stress hormone, and there is not enough serotonin being produced, and this essentially, like, this imbalance can just build up and then it just explodes in depression. So the third factor causing depression is serious chronic illness. So chronic illness is, there's no cure for it. So chronic illness is, up to 1/3 of individuals with a serious medical condition do experience depression. So those with the illness must adjust to the new factors of their life, like if they're in a wheelchair for the rest of their life, or say they get cancer, they have to look at themselves without hair, or they have to maybe like inject themselves if they get diabetes. The rate of depression with heart attack is 40 to 65%. So in other words, 40 to 65% of people that do experience a heart attack get depressed. And for cancer, it's 25%, Parkinson's, it's 40%, and multiple sclerosis, 40%. So, and then a total of 90% of the 33,300 suicides that were committed were caused by a depressive disorder. So in conclusion, many of us in this room are vulnerable to getting depressed, and being an undergraduate in college is obviously stressful. We're getting used to this workload and everything, and many are also in a phase of life where alcohol and drugs are experimented with. So taking care of yourself and creating a support system with your family or your friends is a great way to avoid slipping into depression. Thank you.